17 minutes past 2 p.m. and we are delving into our discussion zone right about now. And it's all about, the myth, misinformation, disinformation about the COVID-19 vaccine. As a matter of fact, I've read a couple of articles. 23 people having, side effects and some actually dying, from taking the vaccine. Administering the Pfizer one, and they're actually investigating to see what are some of the causes and allergies, side effects, and it brings to mind the question like, are we safe taking the vaccine that is meant to protect us? This is not supposed to be killing us. This is something that's supposed to be making us immune. That is what I'm looking out for in that vaccine. But then let's get to our people in the studio. Hafiz, Epi, and Mommy are already right here. Let me begin with Hafiz. Chief.
Big man.
I'm returning the favor today. You're the chief today.
Okay.
Yes. I mean, COVID-19 vaccine, aside the Wahala, new strain and all, we're looking for a remedy.
Okay.
And giant pharmaceutical companies have come out with various, types. Moderna, Pfizer, Sputnik. I mentioned the name as if it's like the alphabetical thing you need to memorize. But these ones are out there and people have started, taking them, administering and everything. But we cannot overlook the issue of people having issues with it, side effects. Others actually going to the extent of dying from taking the vaccine. Where are we going?
All right. First off, Barry, I'll be careful before putting out such information out there in that manner. But then let's quickly look at what the words they mean: disinformation, misinformation.
Right.
And largely, these two words, the difference between these two words is just the intent. Okay, misinformation, you could actually misinform someone unintentionally. So say you've been asked to come at a place 8 o'clock, and then you go about telling them it's 10. That's misinforming.
Right.
Yes, but with disinformation, it's pure propaganda. The whole idea is to disarm your opponents or someone with wrong information.
Right.
So that's the whole idea there. Now, as far as the skepticism surrounding vaccines go, or vaccine hesitancy, if I should put it that way, it's not a new phenomenon. It's something that has been around for a while. Even the World Health Organization says it's one of the top 10 threats to global health.
Okay.
So it's something that they are very well aware of. But then, coming back to our base Ghana, we haven't had the vaccine. But here we are talking about even whether or not you want to take it or not take it. And this surely has generated a lot of conversation.
Right.
Rightly so, because, the fact that it's here and eventually comes, that it doesn't mean everyone is going to embrace it. And there are reasons. But then looking at all the, the harm or the devastation this whole situation has caused our social and economic life.
Yeah.
And we are having to live with this so-called new normal for a while.
Right.
You think that people will jump at it. But you still have a lot of people being skeptical, would rather drag their feet when it comes to answering a yes or no question regarding whether or not they want to take the vaccine. Now, the thing about a vaccine is that, or even medical products to start with, medical products usually still have
side effects.
Yes, a risk.
Even the ones that you're sure of.
There are risks involved.
Yeah.
But when it comes to the acceptance of vaccines, now there's one foundation that is laid on, and that's trust. Unfortunately, that is in short supply these days. And so you have a lot of people dragging their feet when it comes to that. But then you can think of a lot of reasons why people would refuse. Now, the number one reason you can say is social media. Yes, a lot of information flying out there. Now, you don't even have to go digging for these informations. On your timeline, they just pop up. Okay, you have all kinds of information out there. I think even before I got in, I saw this story about Nigeria dealing with fake COVID vaccines already. So on the market. So
see that.
Exactly. So these things you don't have to go digging deeper for these informations. The World Health Director Tedros has actually referred to that situation as an infodemic.
Okay.
Yes. And so when you have if you have misinformation and disinformation and pandemic proportions, of course, you're going to have an epidemic on your hands. And that's what he's called it. And you can understand how, the social media companies have tried to, to deal with it, looking at the sheer volume of information that that is shared on the various
their
platforms.
platforms,
Yes,
right.
exactly. So it's a huge problem, and they also recognize that because most of the information we get is from these places,
Okay.
unverifiable. Okay, even some of us that have at least attained some level of education.
Yeah.
I mean,
You sometimes get misled. It's true. That's very
exactly,
true.
we fall prey to some of these things that are put out there,
Yeah.
and you definitely don't know how to verify these informations. And so, one of the major causes of some of these, situations that we find ourselves, especially regarding vaccines, is social media. Now, the other reason is simple, Barry. At this moment in time, no physician or a doctor can look you in the face and say, Barry, just take it.
It will work.
I've done this for 10 years. It's new.
Yeah.
He can't confidently say that.
Right.
Because, I mean, if you have your doctor say that to you in the face, I think that is much more reassuring.
Right.
Yes, and it will definitely calm your nerves when you want to take it.
Mm-hmm.
But as we sit and watch it, I mean, no doctor can tell you that for sure. That,
Confidently.
exactly, and tell you, Barry, take it. Because we all react to some of these things in a different
Differently,
way.
right.
So there's that. There's also the issue of companies that come with a sketchy past, if I would put it that way. Yes. Now, we've all heard of Pfizer, we've all heard of BioNTech and all that.
Right.
All these companies that are racing to develop COVID-19
vaccine.
Yes, and recently we read somewhere that Johnson & Johnson have also
come up with their own.
their own. The interesting bit about this is that it's only one shot. Unlike the Pfizer that, you take the first shot and then 3 weeks later you take the second to get the 95 immunity that it talks about.
Right.
Johnson says
Just one.
Just one.
Like double booster.
Exactly. Now, it's all well and good with Johnson. I mean, but then the problem with this company is that, I mean, in 2018 they were in a lawsuit. Yes, involving 22 women that talked about the fact that using their products, exposed them to ovarian cancer.
Right.
And for that reason, the plaintiffs walked away with 4.7
billion. Right.
And this is a company that is venturing into vaccines. And a lot of people are like, nah.
Start raising eyebrows.
I'm not going near that. And so, I mean, all these problems and coupled with a lot of others are actually leading to what you are terming disinformation or misinformation.
All right, thank you very much, Hafiz. Let me move on to Epi. The vaccine is out there, and as some countries have actually started rolling it out, and people are being encouraged to go, take it and all of that. But the issue here is the informations keep coming on and going off. It's like you take it, you'll be okay. You take it, you could develop something else again in the future. What's the situation?
Like Hafiz already said, we're not certified health professionals.
No, not at
all. First off, we're putting that out. We're not certified health professionals, and
as a matter of fact, just for the record, some actually are not willing to speak out on this, more of like the efficacy of it. Just like Hafiz mentioned, you don't find any physician telling you that, take it would work 100%. So they are being very cautious about it, but encouraging people to go grab what we have at the moment, right?
So anything we say is actually, I think, based on research we have done and ideas
and publications out there.
Exactly.
Right.
Not because, we're certified health professionals.
Talk about publications. Before you go, now 23 people died in Norway within the days of receiving their first dose of the Pfizer COVID-19 vaccine. 13 of those deaths, all nursing home patients, apparently related to the side effects of the shot, health officials have said. Now, Pfizer has actually is actually looking into it to see what went wrong.
Wow.
That's
one of those. Okay, Epi, you can come in.
We have different side effects to the various vaccines. In the first place, I think we have to establish the fact that definitely there are side effects to some of them, because like Hafiz already mentioned, how you might react to something, so the same way I'd react to something.
Okay.
Some kinds of foods I'll take, it doesn't do nothing to me. Some people will take it and then, they react in a different way.
Okay.
And the same applies for the vaccine. We've had people who have come out to say they didn't experience any side effects. We've had people who have come out with quite disturbing side effects. I mean, side effects that would make you want to think like 4 times before wanting to take the
When you talk
vaccine
about
in the first place.
people, are you talking about people in your space or to people abroad that
No,
you've
people
had
in my space. I
encounter with?
haven't had anybody in my space who's been
Okay.
vaccinated who's gone for the vaccine.
Right. I mean, we
I
don't
mean,
even have it
people
in Ghana,
in
do
my
we? No.
space,
So
yeah.
yeah, maybe
The
people abroad.
yes, people
Right,
abroad.
right,
Best,
right.
The best people in my space have done is get tested,
Okay.
but
right.
not, go for the vaccine.
Okay.
And I mean, all these are coming from abroad.
Okay.
Now people had this, shall I say, misinformation in the sense that it wasn't they were not misinformed, but they had this perception
Like
that
a
the
myth?
vaccine,
Uh-huh.
the vaccine actually had the power to alternate your DNA.
Oh. Okay. That's new.
And it's one of the myths that is flying, all the misconceptions that are around there. And one thing people know, one thing we know is that based on the 2 vaccines that have actually been approved in the United States by the pharmaceutical companies Pfizer and Moderna, injecting the mRNA, a molecular roadmap to prompt the body's production of coronas, which is a spiked proteins, is similar to the kind the virus uses to attach to the human cells. So basically, your body learns to look out for, if exposed in future, to the actual virus, and then it spikes. So they're saying it's not going to alternate or actually mess around with your DNA.
Your DNA.
Yeah, it's not going to change your DNA in any way.
Right. You just made mention of Moderna, and I have this publication that says allergic reactions prompt Moderna COVID-19 vaccine pause in California. I think the US and the UK and other European countries are the large consumers of these particular, vaccines. Talk about
Exactly.
Moderna and Pfizer. Now, public health authorities in California are seeking a halt on dosing of one lot of Moderna's COVID-19 vaccine after reports of allergic reactions at one immunization clinic. So, I think, Maud, I think this actually brings to that issue of people having second thoughts about the vaccine.
Oh, yeah.
Because this is where it was manufactured, 95% efficacy, you take it, and then these people actually stopping it. You know how paranoid we are? Me as an African man, I'm like, Charlie.
Yeah, paranoia is in our DNA.
If this is happening, from abroad, and sometimes how that misconception, like things there are so way better, and now the betterment of that particular vaccine over there is not manifesting. How do we trust it?
I mean, it's hard to trust something that is deemed
Almost perfect.
almost perfect,
95% efficacy.
and then we are hearing people die out of it. People are reacting negatively
Yeah,
to
yeah.
the vaccine and all of that. And I mean, it's just then you're beginning. Oh, you're already having questions in your head, and then you're hearing people are dying. So then it's like there's a turmoil going on in your head right now. Because I mean,
Caught in a dilemma.
is will we take the vaccine
Or not.
if it should be imported in here? And why are we not trying to make one of our own?
That's another question. The African Union apparently has secured 270 million doses of COVID-19 vaccine. So, with that in the picture, what are we looking at? Hafiz, and don't forget, I mean, governments in Ghana, well, let me start with our own. The president said Ghana would not be left out when it comes to securing the COVID-19 vaccine. So obviously, we're looking to get one of these from Sputnik or Moderna or Pfizer. And now that, Charlie, what are the options? What do we have?
That's an interesting question.
Yeah, what are we doing,
What
yeah?
are we doing? Remember some time ago, the president met the heads of pharmaceutical companies in the country.
Right.
We haven't heard anything since then. What exactly happened?
I think it goes along. Okay,
And
Mommy.
yesterday there was I don't remember which show it was, but there was this show on TV
Right.
where they were talking about herbs.
Trying out herbs, huh?
Trying out
Herbal
herbs,
medicines.
because it's like we are here. We have seen herbal medicine work in so many different on so many different occasions. So why are we not trying that?
Talk about herbs.
You see, there's a lot of investment that goes into research and everything. The question is, how much money have we invested in research when it comes to health?
Right.
We haven't. We haven't done all these things, and we've been caught pants now. That's the whole thing. But then, talking about this whole misinformation and disinformation thing, and Africa's secure, because when you talk about securing the vaccine, even here in Ghana, the problem is that we are relying on COVAX.
Yeah,
Yes.
the scheme, right?
The scheme.
Yeah, I mean
So
Nigeria
it
is
means we
already
don't
on
even
board
have
with it.
money of our own to
Yeah,
put
I
in.
mean you need to render yourself poor
We're
to
looking
get
at in Ghana
support.
here. We're looking at the first quarter. That was what we're told officially. Now
Mm.
it's looking like more like June, July.
June, July,
Yes, that's what
and we're
the
still in
official.
early days in
So
2021.
so what exactly is going on? Now, if look, we are here talking about misinformation and disinformation,
Mm.
and personally, I don't think that is actually the reason for this skepticism surrounding vaccine.
Really?
I don't. I
Okay.
think the problem has to do with the relationship
Between the
people
government
and
and
the
the citizens. Okay.
because then how do you explain in an era of the best of vaccine science, in an era of the best vaccine safety and regulations, you still have a doubt in public?
Mm.
That's a paradox. How do you explain that?
Mm.
Because clearly there's something missing in the relationship.
Oh
with
yeah,
someone.
yeah.
Okay. Now instead of constantly working hard to dismiss these rumors or these things that
Yeah.
you have, why don't you concentrate on addressing it, listening to the people and their concerns,
Mm.
and what exactly is going on?
Right.
Because in there somewhere you'd find underlying issues
Mhm.
where you'd able to address
You have
some of these,
professionals that can
Exactly.
talk. Yeah,
Mhm.
talk about them.
but we are not seeing that. You see, because these rumors are definitely coming from a genuine place. Sometimes
Oh
you don't even know
yeah,
how to express
concerned
it.
people.
So
Right.
now here we are told that the vaccine will be rolled out in somewhere June.
Mm.
That's if everything goes
Goes
according to the
according to
timetable.
plan. Right.
Unless we don't see a shift in the timeline again,
Mm.
we are looking at June. Now, what are we doing from now till then?
Mm.
Are we? I mean, I'm not seeing a robust campaign or trying to, engage the public,
Right.
trying to, make them understand, address the fears,
Mm.
address the benefits, the risk that comes with it,
Yeah.
so that I know that you're actually putting out the information there.
Mm.
Then I decide to know what to do with that information before that time
Yeah.
comes.
How to keep up.
Because we
Yeah.
are waiting now for that time to come, and then we have a new problem on our hands.
Mm.
Now we are having to run around begging people to actually do it, or sometimes even threaten them with certain things, just so you would have people go out there to, to avail themselves
Yeah.
to the vaccine. So
Mm.
we have this whole fire approach to dealing with our problems.
Mm.
It's time we start to be proactive rather than reactive.
Well,
to solving some of these
the
issues.
president has ordered the IGP, and of course, in turn, him ordering his men to enforce the nose mask wearing in town.
Maud is
But
shaking her head.
unfortunately, yeah, I mean, I agree with her totally. I think out of 100 people, you still find a chunk, number of people not wearing the mask, and I find myself asking, so where's the enforcement here? But Rwanda, like I said, has ensured a 15-day lockdown.
Okay.
Not a good news in Mozambique because dozens of students have actually tested positive. That's upon going back to school. Another issue, and it's not looking good. Like you said, the information is not there's no coronation. You don't find people and government and citizens on the same page. There's this and there is that. Now look at Nigeria. 1/5 of the population will be having access to 42 million doses of what they're going to be securing through the COVAX scheme. The thing is, what's the situation? We would try and get in touch with one of our correspondents in Nigeria. So maybe if possible, everything goes well. He tells
It's
us
sad. It's
how-
sad the situation we've
Mm.
actually found ourselves in because a nation, a continent of about 53 countries, and we have this issue. Now we are looking forward to other countries to actually do something about this before we decide to do something. So obviously, I think what we should try to learn from this whole COVID experience, if we ever get out of it, is that we need to ask people or those in authorities, to be accountable.
Right,
We need to set our priorities straight.
right.
Okay.
Right.
And it's very clear that in these parts we prioritize different things.
Mm-hmm.
Okay.
Mm-hmm.
We have new ministers coming in,
Mm-hmm.
obviously, or new parliamentarians. A lot of them are going to be angling for V8s and all that. We've left all these things. So
So
I mean, we
before I get to you, let me just
Yeah,
jump to
anyway.
let me just. So aside that, so it's all about making all tests results available to the national grid. This is with respect to our base Ghana, where every private laboratory is supposed to bring every tested, person that they've tested to add it to the national grid, because obviously a lot of people have gone to do that independently and are roaming with the results in their pockets. Yeah, it's like I've tested and I mean, I know a friend who told me he has tested, but he won't tell me the result. I'm like, okay, stay away from me for the next, I don't know, but stay away from me. But looking at that, it means that we have more people infected with the virus in Ghana and other parts of the country, other parts of the continent, hovering around, saying, okay, maybe they are asymptomatic, not showing, but still going ahead to spread the virus. And now with the development of the COVID-19, strain, which affects people even faster than what should I say, the early one.
We are told the vaccines are actually able to deal with.
But before it gets here, we
so
don't have the vaccine here. So how do we, from now to that time, what's the situation? I think that's where the misinformation lies. Epi, you want to step in?
What's the misinformation like? How?
I mean, what I'm saying is, what is the situation? What are they saying with respect to that? Just as Hafiz said, now to June, has there been anything, or what do you think should be that layer that would link us, the people, to hanging in there, or getting us to believe that, this is real, COVID is real, and we really need to get back to the old drawing board?
With what is on the ground, do you really think there should be a hanging in there?
Yeah, we don't have the vaccine. What can we do?
Yeah, but hanging in there whilst the numbers increase or the cases go up. Where's the hanging in there?
So
look, I think,
and also the thing is, hanging in there. Do you have a certified hope that the vaccine is actually coming to do the work it's coming to do? Take into consideration the reports that are coming in from, the US and the stuff. You have a nurse who has actually been vaccinated and now gets the coronavirus
again
after being... No, she didn't have it.
Oh, okay. That's
because
new.
most of the people are vaccinated against getting the thing.
Is that real? Or that's like...
That is real. It's from the ibtimes.com. You can go there and check the portal.
Okay.
And then you have the woman whose husband died. He suffered from a brain hemorrhage after reacting to the vaccine. And Pfizer has come out to say that they can't find the connection to the man's condition, but they're still looking into it.
So the question is, who do we believe?
So where is the hope? You see, and Hafiz was saying about the relationship. In this case, where you were saying that the leaders, bringing it in and the leaders have to go and beg the people to come and take it. It's not about when something can actually work for itself, you don't necessarily have to market it to the people. If the leaders can guarantee, they can certify, if it's actually probably it came out and then it's cured the people, or it's actually brought to an end, or we don't have all these mixed reports coming in.
Right.
I don't think we actually have to go out and get people to say, oh, you really should believe in the vaccine.
We will go for
because this is a matter of life and death.
Right.
So it's not something where you can come and market it well for somebody to actually buy into it, or you market it badly for people not to buy into it. Because the least mistake with it could cost them. It may not cost you your life, but it could cost them their life.
Right,
so
right.
Can we guarantee or certify that this thing that we're actually importing and bringing in,
it would work?
It's going to work. I mean, last week, I think when we first started looking at this whole COVID-19
it's not like you have
thing,
any choice out
that's
there.
the thing, you see. But when Africa first decided that, okay, they're going to actually bring it in, is it the West Africa Center for Disease Control also? They actually said that before they even allow an African country to actually vaccinate its people, they're going to check it.
It'll be a review.
Take it through, their processes and ensure that it's going to work for our people. It's more like tailored to suit us. When you talk about genome-wise and the rest, has that been done?
But how do you tailor something you had no hand in manufacturing?
In manufacturing, that's the question.
Because anyway, that's an
and you see, and the same way. So how do you trust something you have no hand in manufacturing to work for you?
Issue altogether. But
anyway,
talking about tailoring, anyway, but you spoke about hanging in there, and I think for most governments in trying to deal with this whole pandemic, I think we are gone past containment. We are talking mitigation now.
Right.
That is the whole priority. And so even if it means begging the people and trying to educate them, well, you have to do it. Because trust me, there are lots of people out there, you actually have better luck convincing a cat to eat grass than actually
It's
tell
true.
them to actually, go out there and make themselves available to the vaccine.
Right.
Yes, I've spoken to, and they're like,
And
I'm
you-
not taking it.
I actually saw this video where some law enforcement officers here in our base Ghana
Right.
was sent. Was it a Western region? So they actually went to, it's like a pub. And people were sitting there drinking. So they went there to actually arrest the people for not complying with the president's directives. Can you imagine all these law enforcement officers didn't have nose mask on? And they were
Okay,
just
and they were
running
arresting
in
people
there with
who
their
were not with the
firearms,
nose
and it
mask.
was on
Anyway.
video.
Mommy,
Yeah.
now till somewhere around June, not just only in our base Ghana, but for other countries in Africa as well, who, I don't know, it's like there's no hope. But maybe under the COVAX scheme, maybe some would actually, I don't know why that is. But
It's embarrassing.
I mean, Nigeria is under the COVAX. When I heard about that, I
For
was
me,
like,
it's
what is
embarrassing. Look,
happening?
a place like South Africa has actually ordered even before waiting on the cover scheme.
Oh, yeah.
That's
yeah,
how good.
yeah.
So, I mean, why can't we do that here in our base Ghana?
Maybe the funding. But then before we get to that, Mommy.
Yeah. So, I personally do not trust the vaccine.
Oh, really?
Yes.
Okay.
I think I've
Straightforward.
said it before. I've
I
told
think
it
she said she
before.
wasn't going to take it. Why?
Yeah.
Your reasons are?
Because my reasons are
Okay.
this vaccine, first and foremost, is coming from the West.
Wait.
Really?
And
Aren't you over exaggerating
on.
things?
wait,
Okay,
wait.
fine.
All
Let's
right.
hear you.
And these are places who have brought down vaccines to which have caused infertility in women for years in
really?
certain cases.
Okay.
I mean, maybe the facts are not out there, but I have read stories.
Okay.
And I have seen, I have read stories, I have read articles where certain medicines are causing infertility in women in Africa.
Okay.
So I, for one, do not trust the vaccine.
Okay.
But
So-
have you taken hepatitis before?
The shot, can we?
My friend. You see, guy. No, wait.
My point is made.
Have you?
I've made my point.
Okay.
I didn't.
Okay. Go on.
Okay. That's
I
fine.
didn't take the hepatitis vaccine.
Okay. So you should go and take it then. I mean, just to make yourself
So
immune.
that is why I was going to say, can we talk about this like
Have you
backstage?
taken
Because then,
yellow fever before?
Ah, you.
but then, I mean, I feel
but maybe
like
you'd want to base your argument on the fact that there are
Something
issues.
else. No, yes,
issues
but not
cropping.
the fact that it's
The-
coming
the-
from
Come on,
the
the
West.
West there.
Come on, what?
The very first day you were born, you took some immunization. Have you forgotten about
sorry,
that?
I didn't have any choice then.
All right.
But
anyway.
aside all of these effects of people dying,
Okay.
yes, pro-choice. Joel just said pro-choice. I was little then.
Okay.
But
I hear.
right now,
Someone
I
made
feel
the
like
choice for
in
you.
as much as
Okay.
you talked about hanging in there, in as much as
Right.
we are hanging in there,
Okay.
could we also, in a way, be trying to do something?
I think Madagascar already did.
And-
Unfortunately, we're not paying
I
much
knew
attention
you were going to go back to
Then they didn't. So
And
Eh,
then-
you drink it and you're good. You don't
And-
need a needle.
And then coming back to our base Ghana, I
Right.
think instead of the government shifting blame onto the people
for the spike.
for the spike,
They should be
I feel
looking
like
at-
we should all. I mean, he should say. I mean, we're all in this together.
I think that's
we
the
did this
misinformation
together.
there.
That is what I
Yeah,
mean. I
but
feel like
people-
that is what is angering
The
people.
Yeah, like
Because we saw.
you didn't say the
political-
entire thing.
Yes, you should
What
have
about
said.
the rallies?
You should have said it was all our fault.
Yeah.
And this is how.
We're all guilty.
This is how it has become now. So let's all work together. Since we all work together to
Okay.
make the cases spike.
Right.
Let's all work together. And like as I was saying, while we are waiting till June, July,
Okay.
we should be doing something. I mean,
Like?
government talk about enforcing. We had it, but we are not seeing it.
Yeah, absolutely. I think I for one, I have
So
not seen.
you would subscribe to on the spot fines?
Oh yeah. For me, I think that's really cool. You pay 5 CDs or 10 CDs, you're good to
Because
go.
if you catch me not wearing
yeah,
a
yeah,
mask,
yeah.
right? You arrest me, you detain me for like 2 days, and I come back.
You're wasting my time.
It's like
Just take 5 CDs.
5 CDs is even too little. Like you detain
It's,
me
you're
for
supposed
like.
to fill it. 5 CD. I'm
Yeah,
not
so
sure.
that's what I'm talking about.
Okay, so 15
If you detain
What
a
if I
person
can't
for
pay?
if you detain a person for 2 days, then
Right.
afterwards you just release them
Okay.
back into the streets. Then I mean they come back and they're like, I'm sure if I don't wear the mask, isn't it 2 days detention that I will get? So we
Anyway.
should be doing something more drastic.
Okay.
And it shouldn't just be about the mask thing, social distancing, all of the protocols that have been set.
I was thinking about the bus, the public transport. The numbers should also reduce again. the actual number that we used to that we
Yeah,
still
I
take
think
at the
the
moment. It
GP
was
to you would disagree with you on that.
well. Let's see. All right, time not really on our side, but thank you very much, guys, for contributing on today's misinformation, disinformation. Some information around there, they're actually misleading. Others are not true, yeah? Others you read from credible online portals, they're like that, but it's up to you to decide. I mean, you read here and someone died, and you read here and someone is allergic and this and that. Not looking pretty as well, but tomorrow we will be looking, should the vaccine be made available at the moment? It's all about accessibility. How do we get this vaccine? Who are those who are meant to get it? And who are those who are willing actually to take? Right here on the Africa Daily Show on Africa Global Radio, our story, our growth, our future. If you missed this part, you can log on to the the podcast version on africaglobalradio.com for more.